Hesi A2 Anatomy and Physiology Review. Question 1. Which type of immunity is acquired through the injection of antibodies from another individual, e.g. antivenom? Active natural immunity. Active artificial immunity. Passive natural immunity. Passive artificial immunity. Passive artificial immunity involves injection of preformed antibodies, antivenom, immune globulins. Active natural equals infection, active artificial equals vaccine, passive natural equals maternal antibodies via placenta/milk. Question 2. The portion of the nephron that descends into the renal medulla and is responsible for water reabsorption is the what? Proximal convoluted tubule. Loop of Henle. Distal convoluted tubule. Collecting duct. The loop of Henle, especially descending limb, reabsorbs water via countercurrent mechanism. Proximal tubule reabsorbs most nutrients, distal tubule fine-tunes electrolytes, collecting duct regulates final water reabsorption, ADH dependent. Question 3. Which of the following neurotransmitters is released at the neuromuscular junction to stimulate muscle contraction? Dopamine. Serotonin. Acetylcholine, ACH. Norepinephrine. Acetylcholine, ACH, is released from motor neuron terminals to bind nicotinic receptors on muscle fibers. Dopamine and serotonin are neuromodulators in CNS, norepinephrine is sympathetic neurotransmitter. Question 4. The folds of the inner mitochondrial membrane that increase surface area for ADP production are called what? Cristae. Cisternae. Thylakoids. Stroma. Cristae are inner mitochondrial membrane folds increasing surface area for ADP synthase and etc. Cisternae are ER/Golgi membrane compartments. Thylakoids are chloroplast structures. Stroma is chloroplast fluid. Question 5. The condition in which the lens of the eye becomes opaque leading to blurred vision is known as what? Glaucoma. Cataract. Macular degeneration. Astigmatism. Cataract is lens opacification from protein denaturation. Glaucoma is increased intraocular pressure damaging optic nerve. Macular degeneration affects central retina. Astigmatism is irregular corneal curvature. Question 6. Which enzyme is released by the kidneys to initiate the renin-angiotensin-aldosterone system, RAAS, in response to low blood pressure? Angiotensinogen. Renin. ACE, angiotensin converting enzyme. Aldosterone. Renin is released by juxtaglomerular cells in kidneys in response to low BP, converting angiotensinogen to angiotensin I. Angiotensinogen is from liver, ACE is in lungs, aldosterone is end product. Question 7. The small leaf-shaped cartilage that covers the larynx during swallowing to prevent food from entering the trachea is the what? Thyroid cartilage. Cricoid cartilage. Epiglottis. Arytenoid cartilage. Epiglottis is leaf-shaped elastic cartilage that closes laryngeal inlet during swallowing. Thyroid cartilage is Adam's apple. Cricoid cartilage is ring-shaped below thyroid. Arytenoids attach vocal cords. Question 8. Which type of gland secretes its product directly into the bloodstream rather than through a duct? Exocrine gland. Endocrine gland. Apocrine gland. Holocrine gland. Endocrine glands, pituitary, thyroid, adrenal, secrete hormones directly into blood. Exocrine glands secrete through ducts, sweat, salivary. Apocrine/holocrine are subtypes of exocrine secretion methods. Question 9. The process of red blood cell formation, erythropoiesis, occurs primarily in which location in adults? Liver, spleen, red bone marrow, lymph nodes. Erythropoiesis occurs in red bone marrow, axial skeleton, proximal long bones. Liver and spleen are sites in fetus but not adults, except extramedullary in disease. Lymph nodes produce lymphocytes. Question 10. Which layer of the skin contains blood vessels, nerve endings, sweat glands, and hair follicles? Epidermis, dermis, hypodermis, stratum corneum. Dermis contains blood vessels, nerves, sweat glands, hair follicles, and connective tissue. Epidermis is avascular, hypodermis is subcutaneous fat, stratum corneum is dead keratin layer. Question 11. The foramen magnum through which the spinal cord passes is located in which bone? Frontal bone, temporal bone, occipital bone, parietal bone. Foramen magnum is an occipital bone at skull base. Frontal bone is forehead, temporal is side of skull, parietal is top/side skull. None contain the spinal cord passage. Question 12. Which hormone produced by the ovaries is responsible for the development and maintenance of female secondary sex characteristics? Progesterone, estrogen, testosterone. LH, luteinizing hormone. Estrogen promotes female secondary sex characteristics, breast development, fat distribution. Progesterone prepares uterus for pregnancy. Testosterone is male hormone. LH triggers ovulation. Question 13. The movement of digested nutrients from the lumen of the small intestine into the blood or lymph is called what? Digestion, absorption, elimination, mastication. Absorption is transport of nutrients from lumen to blood/lymph. Digestion breaks down food, elimination removes undigested waste, mastication is chewing. Question 14. Which part of the adrenal gland secretes epinephrine and norepinephrine? Adrenal cortex, zona glomerulosa. Adrenal cortex, zona fasciculata. Adrenal cortex, zona reticularis. Adrenal medulla. Adrenal medulla, chromaffin cells, secretes epinephrine/norepinephrine. Cortex secretes mineralocorticoids, glomerulosa, glucocorticoids, fasciculata, and androgens, reticularis. Question 15. The biceps brachii muscle attaches to the radius and the scapula. When it contracts, which movement occurs at the elbow? Extension, abduction, flexion, rotation. Biceps brachii flexes the elbow, brings forearm toward shoulder. Extension is opposite, triceps, abduction is away from midline, rotation is turning movement. Question 16. Which white blood cell type releases histamine during allergic reactions and inflammation? Neutrophil, lymphocyte, basophil, monocyte. Basophils release histamine and heparin from granules in allergic responses. Neutrophils fight bacteria, lymphocytes adaptive immunity, monocytes become macrophages. Question 17. The clear watery fluid that fills the anterior chamber of the eye is known as what? Vitreous humor, aqueous humor, lacrimal fluid, cerebrospinal fluid. Aqueous humor fills anterior chamber, between cornea and lens, produced by ciliary body. Vitreous humor is gel in posterior chamber, lacrimal fluid is tears, CSF is in brain/spine. Question 18. Which part of the brain is responsible for balance coordination and fine-tuning motor movements? Cerebrum, cerebellum, brainstem, limbic system. Cerebellum coordinates balance, posture, and fine motor movement. Cerebrum is higher functions, brainstem vital reflexes, limbic system emotion/memory. Question 19. The correct order of the layers of the epidermis from deepest to most superficial is which of the following? Corneum lucidum granulosum spinosum bile. Bile spinosum granulosum lucidum corneum. Bile granulosum spinosum corneum lucidum. Spinosum bile granulosum lucidum corneum. Layers deep to superficial, stratum bile, spinosum, granulosum, lucidum, thick skin only, corneum. Any other order disrupts the sequence of keratinocyte maturation. Question 20. Which hormone increases blood glucose levels by stimulating the liver to break down glycogen into glucose? Insulin, glucagon, aldosterone, cortisol. Glucagon from alpha cells stimulates glycogenolysis in liver, raising blood glucose. Insulin lowers glucose, aldosterone regulates sodium, cortisol raises glucose but via gluconeogenesis primarily.